Sedation dentistry. You like it. You do a lot of it.
We do lots of this. We love it. Most important thing, patients love it.
Okay.
So this is how it works. This is what the patient can expect. There's different types of sedation, different ways to do it based on every individual's expectations and needs at the same time. It's not the beautiful thing about sedation, it's an art. It is artistic.
There's an art to sedation.
There's an art.
Okay.
Every personality will get sedated with different range of medications.
Okay.
Simply paced. Some people will be okay with just oral sedation, which means we give them a pill or two before the procedure.
Okay.
Takes just the edge away, so more relaxed, more comfortable. The beautiful thing with this is that you lose the sense of time. So if you spend 2-3 hours in dental chair or 2 hours, it feels like 20 minutes.
Okay.
Second, these medications we're using are very powerful in terms that they take the memory away. So you don't remember much what's going on, or you remember zero, nothing.
Okay.
Even though you are cooperative and you are responsive during the procedure.
Okay.
For some other cases, we do IV sedation.
IV. Okay.
So what's the difference? That's a true sedation, proudly, because we are fully certified. We have a center where we provide this service. So obviously, as the word implies, you go in the vein, and we place in the vein a little tube, and we give the medication in the vein. What's the difference? We get more sedated. It will bring you deeper. We use this for mostly for our implant surgeons, implant cases, or anybody.
What do you
Anybody
monitor when they're getting sedation?
who needs dental work has fear about this. We monitor everything. We monitor the breathing, mostly how they breathe. You know, to be more technical, we measure blood pressure, the heart rate, the vital signs, as you call it. We have something called pretracheal stethoscope. Without saying technical, we have a little basically speaker here, and we hear every single breath.
Oh, nice. Okay.
And because we specialize on this proudly, we have speakers in the room, and everybody in the room, the doctor, myself, and the staff, listens every single breath the patient is taking. So what that means, somebody, let's say, gargles, or something going on. Some people have sleep apnea.
You can hear it.
You can hear the whole room, so take action right away.
Good.
The idea is to have it comfortable for the patient. And what I'm hearing back, that's the most important, here and telling us, just as I love it, is the wish they knew earlier. They have too many patients come in and say, oh, I'm scared of the dents, I have bad experience, my sister had bad experience, my mom is telling me, and they just don't start. Don't let the fear be a factor, because there is a solution. People ask me, do I need to take some special precautions? Yeah, we need to have somebody to drive you home. You're not supposed to drive home.
Okay.
You come with empty stomach, that's part of the process. We educate you, we spend time with you to prepare you for the procedure. The beautiful is that you come to the office, we sedate you, means you are nice and sleeping and comfortable. You wake up and that work is done. Some other cases, more extreme, we have actually the option to have them 100% out. We work with anesthesiologists who provide what's called general anesthesia. The word implies
But
that
most of the
100%.
time you're doing
But
IV
this-
sedation.
IV sedation, that's the everyday procedure. Once in a while, some cases require general anesthesia, either because medical issues. I'm too sick to do this. You're not too sick. We have specialists who can treat you.
Okay.
So I have cases that are basically extreme cases. We never turn a case down, ever. I had a patient with very severe, COPD. He was sitting in a chair, barely breathe, and he needed work, he had anxiety. Option number one, ignore the COPD and just drill his teeth. No, general anesthesia. It's actually safer in the hands of
And you gave them
anesthesiologists.
upper and lower new teeth.
In this case, upper lower teeth, or whatever they need. In this case, it was a single implant, can be anything. Was less of a procedure, but anything they need. It's basically the whole idea is to make you comfortable enough. But the majority of the cases, like 95-99% of the cases, we do IV sedation. The difference is you're not 100% out, but you are very relaxed, almost half sleep, half awake stages.
Okay.
Almost like imagine you take a long flight to China, you miss the flight, you have to stay in Europe for 40 hours, and you sleep in the couch like this airport. Once in a while you wake up, see where you are, you realize in the airport, and go back again.
Okay.
That's a stage. I know if you describe it enough, but it's very comfortable because you don't remember what happened, you lose a sense of time, and takes the fear factor away. So, long story short, there is a lot of tools available, a lot of procedures, a lot of options.
Okay.
If you want to explore your options, let us know. Let us know how we can help you overcome anxiety, fear, previous experiences that prevent you from getting the benefit of what we can do for you. Doesn't matter, it can be a single crown. But if you ignore it, it becomes an implant. If you ignore it, it becomes a bigger problem.
So even a single crown, you can
Some
still give
people
them
need
sedation.
You can do to anything. It can be something simple. Depends on if you have anxiety. If the anxiety prevents you from having the work.
Okay.
Yeah. Some people, a single implant So for some people, it feels like, oh, it feels like a brain surgery. It's very simple. 20 minutes, we're done. But if this, however, the procedure provides you anxiety, distracts you, doesn't make you feel comfortable, fine. We sedate you before you know it, it's done. There is a choice. There is a solution. Let us help you.